Joining us now in the studio, Mississippi House of Representatives member Tom Miles. He represents District 75. That's Rankin and Scott County, just to our east here. Good afternoon there, Representative. Thanks so much for coming in.
Yeah, good afternoon to you, too. I'm proud to be on you for the first time.
Yeah.
And congratulations on your new show.
Appreciate that.
JT was always a great friend of mine and close to. We all miss him, but you're doing a great job
I appreciate
with the show
that.
as well, and we appreciate your hard work behind it.
Thank
commitment.
you. Appreciate that. Enjoying that. So, wanted to talk to you first, Representative, about a measure you're proposing that would benefit first responders to the COVID-19 situation, and a little background about your mom. Share that with us.
Yeah, my mom was a nurse for close to 40 years here in my hometown, and she was the first nurse that passed away from COVID in the state. She died on May the 1st of last year. She ran I guess you could say she was kind of semi-retired. She was trying to get to 62. She had been 62 on August the 23rd, and she said, if I can just make it to then, I can just retire all the way and enjoy it. But she didn't quite make it, but she had every other weekend she basically ran the emergency room there at our local hospital, and she contracted COVID working there in the emergency room, taking care of her patients. You know, I was kind of selfish. I said, Mom, don't go down there. I said, you don't ever know what might happen. Just go on. Just tell somebody that I come in contact with somebody. She said, Tom, you don't understand. She said, those are our people and our friends and our family that come in that local emergency room. She said, they expect to see me. I've been their nurse for the last 35, 40 years, and I've got to take care of them. That's what I'm supposed to do. And it's been tough. It's been tough for my family, been tough for my dad, transition. You just don't expect to lose your mom so young in life. But, she gave her life doing what she loved to do, just taking care of her patients.
Well, first, so sorry for your loss. I do remember when this occurred, and I remember it being reported as the first nurse, I think, to actually pass away from the disease. And thanks to her, through you, for her service and her commitment. It's just incredible. But I think, Tom, that same level of commitment and that passion for the work, I think that's fairly common across the first responder community. And this is the combination of that understanding and you being exposed to it for your whole life, essentially, with your mother working in that occupation, is what drove you to introduce this measure. Is that fair to say?
It may have some to do with it, but if we back up a little bit, I've served myself on the local search and rescue team in Scott County, on the dive team, and got a lot of friends in this. And when I was first elected in my first term in 2013, we started working on the issue for if our law enforcement officers or firefighters, and back at that time, our emergency management people that worked for emergency management and some of our first responders it was kind of vague if they were covered or not under the death benefit. At the time, we had a $65,000 death benefit in the state, which is one of the lowest in the states. And we formed a great coalition with firefighters across the state, the emergency management, first responders, and our law enforcement, and even with the help from the insurance commissioner, Mike Cheney, we were able to get passed in 2014 to increase the death benefits to $100,000. And we've tweaked it here and there over the last several years. We're always doing something with it one way or the other. But so that's kind of where that's really came from on that.
Okay.
When the news broke on this thing, it was brought to our attention that some of our first responders were being denied the benefits to the families for the COVID benefits on this. And I think there's been maybe some things, or if the language is clear or not, should we cover this under COVID or not? And is it work related or not? And so we backed up, we did a little research on it, and on the federal level, before President Trump left office, he signed a rescue bill that said basically that COVID would be considered line of death on the federal benefit. And we've tried to make our benefits and our bills mirror over the years over this. And And I guess some have said that the language has maybe not been clear enough on that. Sheriff Rushing, who's over the Sheriff's Association, he was told to get an opinion from the Attorney General on that. And after I said all of this was going on, I said, there's got to be a better way to do that. We all know that our state is getting about $1.8 billion from the last rescue plan, and we're looking at ways that we can spend that money. There's certain stipulations, and we're still waiting on the final ruling from the Treasury on how we can spend it one way or the other. But and I spoke with our legal counsel in the House, and they feel like that we can cover first responders, law enforcement, and firefighters in this. And there's been a request from the healthcare workers side as well, because our bill, the way that it's in its current form, covers public employees, but we've also had several people that are paramedics that work on the ambulance, and that's been one thing that we haven't been able to cover in the other bill in the past because they're private owned, but they've lost their life as well. I think I had a dear friend in Rankin County that was one of the most known paramedics in the state. They worked for one of the local companies there. He passed away, and there was a couple more in the state. And then you've had nurses and doctors as well, So I just think that's a conversation that we ought to have.
Sure.
We were excited to see when Speaker Gunn sent his request telling everyone that we had the votes and that we're going to pass the medical marijuana bill to the governor, that he requested, and one of his requests was to let's go ahead and fix part of this now for this. So hopefully we can get some traction on this and get it moving. And it's up to the governor. He puts that in the call. But if he does it, we'll be back in January and we can talk about it then for sure.
Do you feel like there's broad support over in the Senate as well?
Yeah, I've talked to senators that have called me after I made my press release and said that they want to help with it as well.
Yeah.
That they would be interested in filing a bill on the Senate side as well. I think it's an issue that everyone's pretty much behind. It's just getting it done and getting the language cleared up.
Yeah. So let's pivot a minute to the medical marijuana bill. We, of course, had Jason White was on with Paul this morning talking about this, and I had Senator Blackwell on yesterday. Feels like this thing's going to happen, that the governor's likely to call a special session in the next few days. What do you think?
It's going to happen. We're just waiting on the call. I think there's been a lot of hard work that has been put into this bill.
Yeah.
We knew who the negotiators were on the Senate side. We knew on the House side. We were told that if we have any problems or concerns or ideas, to let these gentlemen know that we're working on this bill and to let it be known. I'm talking about everyone knew since we left the Capitol who was going to be on this. It didn't matter if you were a legislator, an agency head, or any other elected official. You knew what was coming on. So if you had concerns or problems, there was plenty of time to let those that were known and let your voice be heard on that. I think when we go back, the bill will be passed in some kind of form. I said it's been out to the public and what's in it. You've heard those guys talking about what's in it.
Yep.
I think you hear some people complaining on one side saying it's too much. You hear some people complaining on one side not saying enough. And normally when you have two sides complaining, it's normally a good piece of legislation.
That's about right.
And because we're not making everybody happy, but I think we're going to get it passed for those that need it for sure. I have a dear friend of mine and one of my constituents, and you don't really know what an issue means to folks till you can put a face on it. I got a real lady that's a constituent, a good friend, and was a good friend of my mom's, that's been going through cancer, and when 65A was brought up, or 65 last year, she made a comment on Facebook, and it kind of brought things into perspective for me. And I think that's what we forget about all the time, that she's terminally ill with cancer, and unless there's a miracle, she won't make it.
Yeah.
But she said to herself, I don't believe in marijuana, but as much treatment and much pain I've been through, that if there's the option, I ought to be able to take it if I want to.
Yeah.
And then I had a friend that passed away a couple years ago, and he was terminally ill with cancer, and the only relief that he got was from marijuana.
Yeah.
And I had someone tell me that amongst all of that, and they said it wasn't legal then, but that was the only relief that he got. So somebody got him some.
Yeah.
And that's, I think that's the thing, that with that, we're not trying to, make it recreational. We're just trying to get it to those folks that are sick and that needs it.
Yeah. That makes total sense. Tom, appreciate you coming in today.
Yes, thanks for having me.
Thanks a lot, and good luck with the bill. Sounds like a good idea.
Thank you for your help.
We'll be right back here on Midday. Stay with us.